Here we have an axial CT imaging through the level of the head without the use of intravenous contrast in a 21-year-old male status post trauma. As we scroll through the vertex, we already see extracalvarial soft tissue hematoma along the right frontal vertex. If we scroll down more, we see a hyperdense extraaxial crescenteric-like collection along the right frontal convexity consistent with a subdural hematoma that extends along the anterior falx here. We also see an epidural hematoma, which is a biconvex extraaxial fluid collection that is hyperdense. Epidural hematomas are usually a result of tear of the middle meningeal artery, whereas subdural hematomas are usually a result of tearing of bridging veins. Subdural hematomas can cross suture lines but typically do not cross the midline, whereas epidural hematomas can cross the midlines but are confined by sutures. Epidural hematomas are usually associated with skull fractures, as we see in this case. We see depressed right temporal bone as well as occipital bone fractures, as well as a complex temporal bone fracture that extends through the mastoid portion of the temporal bone and the petrous portion of the temporal bone, which may not be as well seen on this study here. This case also highlights the appearance of subarachnoid hemorrhage with hyperdensity seen within the, or insinuating within the sulci here. We also have right to left midline shift or subfalcine herniation with 6 millimeters of leftward shift present. Notice that there is no evidence of ungular herniation or transtentorial herniation, as the suprasellar cistern and the quadrigeminal plate cisterns are grossly patent. So this was a complex trauma with subdural hematoma, epidural hematoma, complex occipital and temporal bone fractures, as well as extracalvarial soft tissue hematoma.